Loss of temperature sensation on the contralateral side is consistent with which syndrome? Rodney.
Okay, well, my name isn't Rodney, and you didn't give me the full clinical picture, but I'm guessing that by saying the contralateral side doesn't have temperature, what you're getting at is that the ipsilateral side has flaccid paralysis, lack of sensation and proprioception, meaning that I'd be looking at a hemidissection of the spinal cord, also known as Brown-Séquard syndrome.
Okay, last patient. A pre-excitation of the ventricle due to accessory pathways, a condition called
Wolff-Parkinson-White Syndrome with...
Let me finish.
Oh, sorry, just wasn't...
It's Wolff-Parkinson-White Syndrome. Nice job. I'm out of time, so I'm going to go ahead and answer these last questions myself.
Just wasn't clear that you were going to be answering that question yourself.
What is Epstein's Anomaly?
Well, Epstein Anomaly is a right ventricular congenital heart defect that leads to the atrialization of the right ventricle, and it is classically associated with lithium use during the first trimester of pregnancy.
Great job, group. I appreciate the effort.
Thanks, Dr. Cox. That means a lot coming from you.
You didn't raise your hand, not even once.
Oh, sorry, I didn't realize that this was like a hand-raising rounds sort of thing.
That's perfectly understandable.
To read, you're late.
Actually, I'm just a med student, sir. My clinical director, actually, she told me to go to the East Wing, and we're on the West. Real funny story.
You're off the hook if you can tell me what to look for in a uremic patient.
For a uremic patient, I'm not really sure what you mean. Like, what am I looking for? Maybe the cause of the uremia, or am I looking for dangerous complications? Cause, I would say it's either a prolonged AKI or end-stage renal disease. And for something that I'd be worried about, I'd be looking for changes in mental status. I'd be doing a cardiac exam to rule out a pericarditis. And then finally, I'd be very worried about platelet dysfunction.
That's my girl.
Thanks, Dr. Kelso.
We're going to play a little game called Answer the Question Correctly or Stay Here Forever. Debbie, what are the neoplastic causes of hyperprolactinemia?
All right, well, for starters, my name's not Debbie, but neoplastic causes of prolactinemia would be a prolactinoma, and then I would say just a regular pituitary adenoma, because that can actually interrupt the inhibitory dopaminergic neurons, leading to a slight elevation in prolactin.
Close, but no Siggy. You'll be staying here forever.
Oh, man.
Okay. What is the demyelinating CNS disorder associated with the JC virus?
Progressive multifocal leukoencephalopathy.
What is the pathologic abnormality causing Bernard-Sawyer disease?
Well, first of all, it's pronounced Bernard-Sawyer syndrome. And I'll let you off the hook, Dr. Reed, because he probably speaks German or something as a second language. But the pathophysiology of the disease is due to glycoprotein 1b, which is a receptor for von Willebrand. They typically present with bleeding.
But I knew I had him. My question is concerning metabolic diseases. Oh, yes.
What is the inborn error of metabolism characterized by angiokeratomas? Please?
You must be talking about Fabry's disease. Mutation in alpha-galactosidase A, I believe, typically presents with peripheral neuropathy. You have some nephropathy as well, characterized by proteinuria. You can get cataracts, and then, as you mentioned, angiokeratomas. UWorld ID 14193.
Can you tell me the treatment regimen for organophosphate toxicity, Dr. Reed?
Well, first I would give intramuscular epinephrine, then IV calcium gluconate, followed by emergency hemodialysis.
Sweetheart, if I wanted you to give me 3 wrong answers in a row, I would have just asked for the usual. Dr. Murphy, care to jump in? I have a speech impediment, sport. You insist on starting every answer with
Well, no, the reason I said is because my name's not Dr. Murphy. Like I said, I'm just a third-year medical student. But to answer your question, for organophosphate toxicity, First, I would make sure that they were on 100% oxygen, and then I'd intubate. Second, I would use atropine to counteract the cholinergic effects. And third, I would use pralidoxamine at a rate of 8 mg per kg per hour and give it slowly over 30 minutes.
What are the 4 differential diagnoses of the persistent ST elevation on any EKG?
Persistent ST elevation, I'm going to go with ischemia, pericarditis, a left ventricular aneurysm, and then I know this is a stretch, but Brugada syndrome can sometimes have it.
What causes pneumonia presenting with diarrhea?
Legionella, which I would treat with either a fluoroquinolone or a macrolide.
Nice job. It turns out your mind's just as sharp as your nose.
Thanks, Dr. Cox. That means a lot coming from you.
Die job. What are the elements of Whipple's triad?
Good old Whipple's triad. The first would be symptomatic hypoglycemia, then hypoglycemia measured with less than 50 on the blood glucose, and then it corrects when I add glucose, and it's evident of an insulinoma.
Today for lunch, the cafeteria has Bruce, name a manifestation of normal pressure hydrocephalus.
All right, well, for starters, my name isn't Bruce. I'm sure if it was Keith or Sean or JD, you could remember it. But to answer your question, I won't even just give you one of the most common signs. I'll give you 3. First of all, urinary retention, dementia, and gait instability. There's 3.
Hell yes, Bruce. Go place a fully cath on bed 4.
Patient is hypoglycemic. What would be the most telling sign of an insulinoma, Dr. Reed?
I mean, come on, Dr. Kelso. For the last time, my name is not Dr. Reed. How hard is it to learn one thing about me, that I'm a med student, and my name? I mean, I literally know everything about you. Your son's name is Harrison. Your dog's name's Baxter. You drive a Cadillac that you call Bessie. You have the tattoo of a man named Johnny on your butt. Come on, throw me a bone. But to answer your question, an insulinoma you can diagnose after fasting with elevated C-peptide.
Score! But before you do your crazy end zone dance, can you tell me the spinal fluid findings in Guillain-Barré syndrome?
Guillain-Barré, I would expect to see an elevated protein with no elevation in lymphocytes in the CSF.
Good talk.
Time's up. Your patient has a sodium channel abnormality in the cardiac tissue that puts him at risk of sudden death. What does he have?
Well, I think there would be a Brugada syndrome or just a congenital long QT syndrome. I'm not really sure how to treat it, though.
It's been 2 days. You're fired.
Whoa, with the 4th degree, you're firing me? Well, first of all, who made you Donald Trump? Second of all, I'm just a med student, man. You can't fire me. I mean, I know I'm no Superman.